My name is Nancy. My husband Dennis's journey started about 36 years ago. Dennis had a failed stapendectomy, which rendered him even more deaf than he was before.
This one's been completely dead for 5 years. This one's probably like 30% hearing with my hearing aids. So I spend all day saying what.
He has always been a very social, kind of fun kind of guy. But then as his hearing deteriorated, he has become a recluse.
If you go out socially and you're hard of hearing, to some people it's almost like a big joke. Can you hear me now? You know, they talk like like there's something wrong with you. Why go out to be at a party if you're not part of the conversation? You sit there like a wallflower.
Dr. Grunfast, he said, you know what? We have a doctor here, Dr. Weber, and I want you to meet with him. I think, that he can help you, and I think it's time for you to move forward with the cochlear implant. And so here we are.
A cochlear implant takes sound from the outside world and changes it into basically energy that will get transmitted into the inner ear and stimulate the nerve directly. So that allows you to hear again. I'm old enough to have been around when cochlear implants first started. That's why I went to medical school. Boston Medical Center hadn't had a dedicated otologist. And so this allowed us to come in, take care of our patients in a holistic manner, and be able to offer patients the ability to be able to hear again. And we can have a significant impact in their lives from a social standpoint, a hearing standpoint, and an employment standpoint.
I've been thinking about an implant for a while, but the biggest thing that's happened to me the past year is my granddaughter. She was born. She's the reason I'm getting it. So we can play, I can take her to the park, and I'll be able to interact with her. I'm not expecting a miracle out of this. What I'm hoping is that just a casual conversation, my wife's in the kitchen, and something little as that, she can say something, and she doesn't have to come out here and talk to me. She can just say it from there, and I'll be able to hear her. Just everyday normal stuff that you people take for granted, I'm hoping to be able to accomplish.
The wire from right here comes down behind your ear into the mastoid and then into the ear.
Okay.
I always joke, right? I am the electrician. I put the device in, but the real work and the real relationship over time is going to be between the audiologist and the patient.
When Dennis first came in, he knew that this was something that he wanted to do. He had researched it, he had talked about it with his family. He knew the journey was ahead of him and he was ready to embrace that.
The first thing I'm going to do is get a processor connected to the computer, connected to your internal implant, and then we're going to start our first map. We'll spend just a little bit of time counting beeps, having you tell me where that loud but comfortable level is.
Okay.
And then I'd like to get you in the booth.
Considering the timeline for a cochlear implant, Dennis is right on average, maybe a little bit ahead of the curve.
It's definitely better, and the people I work with and my family members are telling me I can hear things I couldn't hear 6 months ago. The one thing I still have to improve on quite a bit is understanding of people. When people are looking at me, not a problem. Once they turn their head around, I still can't understand them.
I think when patients make that commitment to go through with the surgery, perceptions are still in the back of their mind. I'm getting this, I'm going to hear right away. And when it doesn't happen as quickly as they want, sometimes people will get a little frustrated. And so our job is also to show them along their journey that they are making progress.
It's pretty exciting watching him slowly start to hear things going on around him. For a while it was, we'd walk into a restaurant and he'd be really quiet. Now, like when we're out in a loud, area where the acoustics used to bother him, he's kind of like weighing in more, which is good because he's funny and he has like a lot to say. I think he's excited to be able to hear my niece, as we all just actually heard.
I'm hoping that Dennis will say that there's a little better adaptation to the overall sound quality. Since it's been a little more time, we're going to get him in the booth and see how his scores presumably have progressed.
A month ago, 42% with just the implant, and today you are at 67%. Do you remember what you were at before you had surgery?
In the right ear? Nothing.
0.
It was completely...
So we've gone to 0 to 67%.
Right.
That's fantastic.
Dennis, throughout all of this, I think has been spectacular. His willingness to be an example for people who are really trying to decide, do I get a cochlear implant, is pretty amazing.
My greatest thing is that Dennis can be able to talk to his granddaughter. What could be more important, right? To share all of his experiences with her. Be able to converse with his daughter, be able to talk to his wife. I mean, that alone does so much for patients and having those interactions. And I just, I wish the best for him. And I know that over time, I know deep in my heart he's going to get there.
I'm really excited to see what's going to happen over the next 6 months to a year. I want to hear Isabel talk. Once she was born, I was, okay, I'm going to get this fixed. I want to hear her say, Papa, can we go out and play catch? She was definitely the deciding factor.